Festival of Health Tech, ladies and gentlemen. Now, may I please again request the BW team to present today's event audiovisual. Can we have the audiovisual, please? Thank you so much. Can I please ask for loud cheers again? Thank you so much. Wonderful. I extend a very warm welcome to all of you. Thank you so much for being with us over here. Let's look forward to collaborating together, growing together, and ensuring that the healthcare space improves and only gets better as a community. As we embark on today's enlightening journey, I would have a request that please ensure that your mobile devices are on silent mode in order to ensure that there are minimum distractions. Before we begin, it's very important to express our sincere gratitude to the organizers and sponsors who have made this event possible. Their unwavering support and commitment to the advancement of healthcare certainly deserves our heartfelt appreciation. The event is organized by BW Businessworld, associate partners AliveCore, Tata MD, Lupin Digital Health, support partner Life Science, event partners Joy Travel Private Limited, Fandrum, Beanley Coffee, Jazbat.ai, The Thick Shake Factory, Reality Plus, Exchange for Media, IWM Buzz, Impact, and Pitch. May I now please request the partner audiovisual to be played for you all, ladies and gentlemen? Can we have the partner AV, please? All right, ladies and gentlemen, just give us 1 minute. So we'll have another AV later, but as of now, it's time to call the man of the moment, Dr. Anurag Batra, Chairman and Editor-in-Chief, BW Businessworld, and Exchange for Media, to deliver his visionary opening address. Taliyon ki goonj, ladies and gentlemen, it should be heard everywhere. Thank you, sir.
Morning. It's my honor and privilege to be here. I'm here primarily because this is a new initiative. It is the first edition of the Health Tech Summit. Initiatives are like children; they grow up and they do you proud. Mr. Harbinder Narula's team is doing a great job in building our health community. I know we started late, but we have an almost full house, and I'm sure as we go along, the energy in the room and the knowledge in the room would match. I only have to say that I'd like to welcome all of you to this first edition of the BW Healthcare World Health Tech Conclave. In the evening, we have our first edition of the BW Healthcare World 30 under 30. And again, the quality of our winners and the impact they are making is amazing. In our initiatives, we try to make sure that we are very inclusive in terms of the kind of people. All areas represented, at least 50% women. I can say in this initiative, we've got close to that. When you see the list in the evening, you'll know that. I also want to use this opportunity to welcome Mr. Randeep D, who's made time to be here. Thank you, sir, for being here. We also have Mr. Vishal Gondal, who's a serial entrepreneur and having been in the gaming space much before gaming became mainstream, so to say, is now clearly trying to make an impact and is making an impact in the health tech space with Goki. So thank you, Vishal, for being here. And I'm sure, like you were, you entered gaming when it was really nascent. So your being in this sector tells us that there's a lot of potential in it. We have Mr. Siddharth Srinivasan of Lupin and Mr. Lokesh Prasad of AliveCore also here. Welcome, Siddharth and Lokesh. I was coming here and, last week was G20 in Delhi. And I said, normally I don't make PowerPoint presentations. You know why, Vishal? PowerPoint presentations are made by people who are neither powerful nor have a point of view. And I am Vishal's friend, so clearly I have both. But on a serious note, I said, what would I talk to a community who knows much more about health tech than me? And what is authentically that I can talk about? So I put together something, and really what is happening in healthcare, health tech, you know it more than me. But just to tell you, in 2021, in India, almost $3.2, $3.3 billion was put in health tech. In 2022, because of macro factors impacting funding, and so to say, there was a winter of funding which continues in some way. The funding reduced to almost 1.4, $1.5 billion. 2023, again, it has stayed around that number. In fact, it may be a little lower, but we still have another 4 months to go in. And 4 months in any domain is a big time, and India is growing. So clearly, you may see more funding in health tech. So I said, what's happening in healthcare in India? And really, I want to keep it short and crisp. Let me say what Elizabeth Taylor said to many of us suitors. I won't keep you long. The 3 P's of healthcare are clearly personalization, whether it's delivery of medicine or services, through usage of technology, through usage of delivery mechanisms. Personalization is happening in every domain. Second is the word that is predictive. You can put, the connected devices, or you have wearables, or these days you have devices which become part of you. So to say, you can match or map your sugar level. You can map how well do you sleep, what is the metabolic activity. So, and hence you can predict what will happen to you. Not only there are technologies which can look at your cavities and tell you what is the risk of your, to your heart. And there are lots of ways to predict where will be your health in couple of years. And of course, the word is preventive. If you can make it personalized, you can predict it. Preventive healthcare. And the health tech companies and health tech products are trying to you match all these three to be able to. And again, when you do the three P's, you clearly come to the three T's of healthcare, which is transparency. This is a domain which is such education and healthcare are such domains that can be transformative and both take up a significant portion of the savings of an average individual. Sometimes there can be more transparency, and today's consumers or healthcare receivers are demand traceability. We went through COVID and the word traceability came to mainstream, but in healthcare it exists in a big way. Trust. Again, healthcare is such a domain where trust is the relationship between the patient and the doctor is the most important. The relationship between a service that an individual uses from the health tech service provider is most important. Now, I was coming here and I say, some colleagues who know me well, Harbinder is more my friend, and he knows, and I was telling him that I'm a little low energy today because I slept at 2 a.m. That's not my normal time of sleeping. I sleep by 10, 11 on the outer. And, I wanted to ask everyone, what will be we know what it is, and especially your healthcare professional, what is the biggest pandemic that is kind of looming large? Absolutely, it is mental health. One in three of Indians are battling with some mild form of depression, and one in four is serious form, and only less than 7.5% are actually seeking counseling to be able to deal with it. And we are a very large, so if one third, that's a very large number. It can have implications for everything. Uh, so anxiety, depression, insomnia, they're all linked in some way. And I want to tell you that there is a there is a new breakthrough in healthcare, and I do read a lot of books uh, on various things. And I read this that there is a new cure. Uh, you know, Scientists have discovered a revolutionary new treatment that makes you live longer. It enhances your memory and makes you more creative. It makes you look more attractive. It keeps you slim and lowers food cravings. It protects you from cancer and dementia. It wards off colds and flu. It lowers your risk of heart attacks and strokes, not to mention diabetes. You'll even feel happier, less depressed, and less anxious. Do you know what this important discovery is? Very good, clearly. So, I don't know, Prashant has done something to it, but it is enough. My wife, day before yesterday, was telling me that Anurag, your life revolves around sleep. And I had read this book many, many years back called Why We Sleep by Matthew Walker. You may have seen his talk. And I read it again on the flight. Ironically, yesterday I slept at 2 a.m. But I can say the last 9 days, I've slept between 10 and 11 um, p.m. and I've slept more than 9 hours every night. Right? So I mostly 25 days. So I think wherever I go, I talk about sleep because sleep is the most important thing that matters. And there was some more slides. I don't know what they've done. My friends at the console, Prashant. Anyway, I'll talk about it. So I know this. Some of you may know this already, but don't compromise on your sleep. And last night I was reading about, I was watching these speeches by the world leaders in the UN General Assembly. I was reading about what's happening between India and Canada, and then I was going into the history. Then I was seeing how did the world press. I read a Times of India article on how the Sikh terrorists were described by various leading publications in the world. So I spent a little more time and I kept my phone in my room. Normally, I keep my phone outside in my home. I keep it in the study far away from me at about 9:30, 9:45, 10, around that time, and then don't access my phone till I wake up in the morning. So, but in yesterday, I had my phone and I don't have a TV in my bedroom. So I had a TV and a phone, and clearly I was not disciplined. So, this is a book that I strongly recommend that you read. Sleep is the most important thing. And when I read this book yesterday, I'm determined to, you know, there are some things that I can do better, I'll still do better. This is the latest issue of Business World, it's on stands. Uh, Vishal is there, some of your entrepreneurs. This is a story of Mithun Sancheti, um, and the theme is how to create wealth. And there is a lovely essay. What is the difference between rich and being wealthy? I'm sure a lot of you are very rich. Some of you are wealthy too. But it looks at how sustainable entrepreneurship can be done and how wealth creation can be done. And it's an interesting cover. Um, there are more slides, Prashant. You should be at the console, my friend. I also want to ask you, apart from depression, what is the other most important thing that we are dealing with as humanity? What did you say, sir? Stress. Of course, but what else? Stress is still manageable. It's what Donald Trump said is a hoax. It's climate change. I I do I do read a lot of magazines and books. And 2 weeks back, I was reading. Can you go to slide 15? 1 5. Yes, it says the first time running a slideshow should be the easiest thing. Yeah. You just have to not mess with it. Let me run it. So I was reading this. I was at the Habitat. I'd gone to meet a journalist friend of mine, and he wanted to meet me at a place where we wanted to meet. So we went to the Habitat Library Lounge, and I first encountered this. Uh, the Time magazine cover said the most important place on earth. And guess what is the most important place on earth? The ocean. Everywhere in the world, there is really impact to global warming. You look at US, you look at the fires in Europe, you look at what's happening all around us. Look at what the temperatures in Africa. They are 4 months ahead of their schedule. The peak temperatures are being achieved in March, April, which used to be in June, July. 4 months ahead, and experts say it may get preponed by another 15 days or 30 days. So clearly, global warming uh, is a reality. We are dealing with climate change, and the only thing worse than Putin's nuclear arsenal would be global warming. And it's a beautiful article which says that the large mammals in the sea, when they leave their excreta, the excreta actually goes to the bed of the ocean, and it is able to absorb the carbon dioxide, and that keeps the CO2 levels, because oceans are becoming smaller and smaller because we are taking over spaces. The flora and fauna in the oceans is getting lesser. It is impacting what happens on the mainland. And then I bought 2 copies of it, gave one to my colleague Priyanshi, who runs our sustainability initiative, and kept one for my daughter. And I still like physical magazine. Uh, I do read a lot of books. It's my passion. I want to end by telling you about 2 books that I strongly recommend. I don't know where did they put in my slide. Uh, but they are in slide 14, and I'll read out. Uh, we all are very busy building whatever we are building, whatever we are passionate about. And it's not just about money, it's about liking what you're doing what you like, making an impact. I read this book in March, and it left a indelible impact on me. I read the second book of the author first. Was so impressed with his second book that I bought his first book. So I read this book called Humankind by a Dutchman called Rutger Bregman. And it's one of the best books I've read, and it basically debunks all theories where it's been propounded that human beings come to their base level, they will fight with each other, they'll claw into each other. Over the last 150 to 100 years, all the research of various researchers that proves to human beings being very competitive and not being kind to each other. Mr. Bregman does the research and beautifully brings out that the facts may be to the contrary. And it is a beautiful storytelling, lots of research, a lot of anecdotes, and it's a fascinating book. It's called Humankind, A Hopeful History by Rutger Bregman. And then I went and read his first book, which is called Utopia for Realists and How We Can Get There. There is a chapter on universal healthcare also. In fact, the basic minimum income plan was first written about in his book. So really, I loved this books, and I believe books. You are the books you read. You are the, you become whatever you read. So I just want to end by saying that be kind to each other. I think that's the most important. Give attention, because these are, sometimes we're too busy with our phones. Sleep well, because if you sleep well, everything else will follow. Because we've gone away from basics. I'm an investor in a coffee company. And last night I was reading about the impact of coffee and how bad is coffee. So I only drink 1 cup of coffee. And from today I'm thinking giving it up. Right? I just want to say that healthcare is a lot about human empathy. Even the devices you build in some way will factor. And I believe the more the role of technology and what's happening with artificial intelligence, that itself is a huge area to dwell into, so I won't get into it. But I think the more the immersion of technology happens, the value of human touch will grow. And I think there's nothing that replaces human touch. There'll be a lot of work that we'll do using technology. I want to say that in the evening, through our jury process, the 30 winners that we've selected, 27 of them are here in the evening. Some of them are really rock stars. At very early age, they're public figures. I know it because, one of them, my daughter wants to interview for her book, and I didn't even know how to get to him. But he's coming here, and I told my daughter yesterday that he's coming here, and Harbinder will introduce us to him. Right? So I just want to say that the quality of our winners and the quality of our applicants was outstanding. It was very difficult, and it's the first year. We've done many initiatives grow. But in the first year, to be able to select and elicit this kind of quality of is also dependent on the kind of jury. So my gratitude to the jury members. We've seen in all our initiatives that wherever the quality of the jury is very high, which is mostly in all our initiatives, I think it attracts a certain kind of people. And since we do our awards honestly, we are a media company, we have to do some things to be able to be sustainable. But awards, we do it absolutely on merit through a process, and you only have to apply. In some of our awards, where we may have to select 30, 40 people, we get 300, 400 entries by the third year. So sometimes people say, oh, I'll put an entry at 10, 15,000 rupees, I'll win. And we have a polite mail draft for them that this is buying a lottery ticket doesn't necessarily make you win a lottery ticket. I mean, we have to shortlist from 300 to 80, 60 people, depending on how many you're finally selecting. So you may not even make it to the shortlist, because in the process of awards is the process of elimination, and then it's the process of selection. So I just want to say that you will meet a very eclectic set of health tech and healthcare leaders who are literally the future of the domain. They are doing exciting work. Some of them, our youngest winner is 16 years old. She'll be here just now in 2 hours talking to us. I wish you luck. And I want to say that the future of health tech is determined by what you do here. I hope when we meet next year, the health tech sector has raised at least double the money than it has raised this year, because the need for health tech in India is huge. We are the largest uh, population of people who are diabetic. We're literally the diabetic capital of the world. I have an MDI junior who was at our health tech event last time we did it. He's built a device which goes in shiftos. He's at I at the cult family, cult.health or whatever he's called. Then I met the ultra human guys who built a device. So there are many people who are tapping into the domain and trying to help people. And for people, it has been a transformative experience. So what you do is not just about it cures families, it builds families, it builds the workforce that we need, and it builds a better India. I wish you luck, and I look forward to more interactions with you. God bless you. Thank you.
Thank you so much, sir. Lovely insights indeed. Some really important topics, I believe, were spoken about: mental health, depression, importance of sleep. After this session, please raise your hands. How many people out here want to improve their sleep pattern? You can raise your hands. I'm raising mine. Wow. So the number is really staggering. Thank you so much. I'll now request the console team to kindly play the partner AV, please, before we move on. Are we done playing the AV? Wonderful. Ladies and gentlemen, it's now time to begin the opening keynote. The topic right now is the vision for healthcare advancements. For this, may I please call upon stage Mr. Randeep D, IAS Commissioner, Health and Family Welfare Services and State Mission Director, Ayushman Bharat Digital Mission, Karnataka, to come up on stage, please. Loud cheers, ladies and gentlemen. Thank you, sir, for joining us. The stage is all yours.
Thank you. That's my photo when I was 93 kgs. I've dropped 10 kgs in the last 5 months. Thank you. Absolute pleasure to be here talking to all of you. Thank you, Dr. Anurag Batra, for that very insightful talk, and you set the tone for BW Healthcare Festival of Health Tech 2023. On the subject of books, I think my self-awareness journey on health probably started by reading books on health, and far away from gadgets, the book by Hacking Health, Mukesh Bansal. He just says 3 things. He says, if you do these 3 things, you don't need to read my book. And that is the disclaimer in the very first few pages of the book. And he says the point that Dr. Anurag Batra had made. The first one, sleep more, which is well covered. And then he says, eat less. And lastly, he says, always move. He says, if you do these three things, then you don't need to read my book or wear any gadgets, or really don't have to go too many times to a doctor. I think that is something which, if most of us imbibe, would really be useful. Because I, as part of the uh, Commissionerate of Health, Government of Karnataka, I see that our country, while it is going to produce brilliant leaders, we're going to be the financial capital of the world probably in the years, but the healthcare burden is going to hit this country very hard in the next 20 years, because we are seeing young people burdened with what we call NCDs, non-communicable diseases. Today, COVID apart, communicable diseases are no longer our concern or worry. Our concern remains non-communicable diseases, BP, hypertension, diabetes, cancer. And this burden is only going to rise as we see younger populations getting affected by it. And most of which can be avoided, most of which can be easily reversed if we adopt lifestyle changes. And even before I start my keynote address, I wanted to share this concern with all of you. So thank you again for allowing me to present the keynote address. I think the topic, Vision for Healthcare Advances, is very apt today with multiple technologies, applications hitting us. Probably in an era where information flows much faster than ever, where technology evolves at a highly unprecedented rate, and where understanding of the human body and mind deepens day by day, we find ourselves probably at the cusp of a healthcare revolution. And these are exciting times. This revolution is, however, not driven entirely by new gadgets or groundbreaking treatment, but something which is far more profound. And that is probably the power of insight, the power of prediction, the power of knowing what is the need of the hour in the coming days. Inside, my friends, is a key that unlocks the doors to progress in healthcare. It is probably an ability to see beyond the surface, to comprehend the intricate web of factors that influence our well-being. As we gather here today, we also witness the convergence of technology, data, and most importantly, I think it was talked about in the earlier session, human compassion and kindness. Because at the core of healthcare is eventually this. Let it not be only into the technical aspects and the technology related aspects. The tools of artificial intelligence, big data analytics, advanced medical imaging, I mean, these are nothing short of extraordinary. Something these tools were not available, say, 10 years back. But I think having these would really empower us to extract meaningful insights from the mountains of information that we have today before us. This helps us with much more accurate diagnosis, early screening, new therapies which are at the horizon, which we can tap into, and helps policymakers like me to probably design much more equitable healthcare interventions on the ground. Let us not forget, while technology and data provide the canvas, as I said, it is human empathy, curiosity, dedication that paint healthcare advancement. Behind every data point, every line of code, there is a person with a vision, as I'm sure all of you here are, and those who are going to get awarded. The vision of a happier, healthier, and a more prosperous world. As I said, day by day, we are discovering that more ailments, diseases are hitting us. Communicable also, the challenge is tremendous today. We are looking at, we're just off the cusp of COVID. We've been hit by a round of dengue infections, children as young as 6 months old up to adults getting infected. We have the huge challenge of Nipah, which is probably hit us the second time in Kerala. And we really don't understand these viruses. We don't understand how really these transmissions take place from animals to humans. So the whole concept of One Health, where we do not look human health in isolation. We've talked about climate change. So it's about human health, it's about animal health, and it is about the environment and the climatic changes. So in One Health concept probably lies the future of healthcare, because today, in the days to follow, we're going to have a lot of zoonotic diseases getting transmitted onto humans, and healthcare is going to face tremendous challenges in not finding adequate treatments. Vaccines apart, we are far away from that, but let us say even supportive treatments are going to be a challenge. So I would like to flag that to this esteemed audience here. The other challenges that lie ahead, yes, of course, ethical dilemmas, because there's going to be a lot of data floating around. We saw some of those images, applications. People are going to question, where is this data going to reside? How is my data going to be kept safe? Is it going to be compromised? So that is something which all of you need to be aware of. I handle the national program of Ayushman Bharat Digital Mission, which is basically a one-stop effort of the government of India and the state to converge all digital efforts together. Recently, you must have seen that the Parliament has passed the Digital Personal Data Protection Act. I would urge all of you to read the text of that and do not compromise on patient data security, because this is extremely private data of patients, which is out there for you to actually use it in unethical ways if somebody wishes so. But this is something which I would urge all of you to have strong systems in place, align yourself with the Data Protection Act that is in place today. And while a lot of anonymized data can be used for analysis with the consent of the users and the patients, but anything which is not in synchronization with the act, I would strongly advise you not to go there. We also have the universal health coverage today. We have the Ayushman Bharat Arogya Karnataka scheme, which we do to cover a fair number of our poor population, where some kind of a medical assurance is given up to 5 lakhs annually to a BPL family, and up to 1.5 lakhs annually to a above poverty line family. So these are again steps which we are pushing and trying to get in a lot of treatments, lot of newer technologies, newer treatment modes into the ambit, so that not only the have-to-dos avail from these benefits, but even the have-nots can access this. So as we embark on this journey of the future of healthcare, I wish BW Healthcare and this Festival of Health Tech 2023, the inaugural festival, to be of tremendous success, and may it help us bridge the gap of ensuring that healthcare truly becomes universal, it truly becomes accessible, it becomes affordable, and it really bridges the gap and makes us understand that what is really essential in today's world to be healthy and be a contributor to this nation, which is going from strength to strength. And each one of us has this responsibility upon us to speak about health and wellness, because that is the new concept. We don't talk about cure, treatment, because we really don't want you to get there. The whole concept is about health and wellness today, that how do we ensure that our diets are good, that our exercise regimens are good, and that our sleep patterns are good, and also how we keep away from anything that is impeding our health and growth. So I think each one of you here sitting here is going to be an ambassador in this area, and do feel free to collaborate with government in whatever initiatives you feel can further this goal. And we are here to join hands and ensure that we reach this goal of health and wellness. I once again thank the organizers for having invited me here to address this esteemed panel of members, and I wish the Festival of Healthcare 2023 all the very best. Thank you.
What a wonderful insight, sir. I'll request you to be on stage. That journey from 95 kg is really inspiring. Can we please clap once again? I think that's really inspiring, coming from someone who's actually been there and done that. Thank you so much. I'll request Dr. Anurag Batra, Chairman and Editor-in-Chief, BW Businessworld, and Editor-in-Chief and Founder, Exchange for Media, to to come up and give the memento. Can we have the memento, please? Do we have someone for the memento?
There was one more slide that got missed. Last year, I went to my lawyer friend birthday on 18th Feb. Sudhir, he'll be speaking and somebody gave him a book as a birthday gift. It's a book by Tony Robbins called The Life Force, and it was all about health tech. So at the birthday, I was sitting sipping my green tea while everyone was drinking the red wine. Rich people drink, like Mr. Gondal, drinking green tea. And I read that book, so I recommend that book. It's called Life Force by Anthony Robbins. Of course, he plugs all his health tech investments in that company. And I wish, like in 2019 or 18, in the US, there were two, Plateon and one more company did their IPOs. They raised almost $700 million. I hope in India, people like Vishal or AliveCore, again, AliveCore is doing great. And I am now reminded that you sent me a device which I should use to be able to measure my. So I just hope that someday the impact of health tech is so big that health tech companies present in this room do IPOs and really impact the number of people in India that need to be impacted. So just want to say that. Forgot to mention that book called Life Force by Anthony Robbins. I don't get any royalty on any of these books.
Thank you, sir. All right, so ladies and gentlemen, we are ready for the first panel discussion of the day. The topic for the moment is the buzz of internet of medical things. To moderate this session, may I please welcome up on stage Mr. Harbinder Narola, CEO, BW Healthcare World and Wellbeing World. On stage, please. Do we have Harbinder sir over here? Yeah. Just give us 2 minutes to quickly set up the panel and then we can go ahead. He'll be joined on stage by Mr. Siddharth Srinivasan, CEO, Lupin Digital Health, Mr. Vishal Gondal, founder and CEO, Goki, Mr. Lokesh Prasad, MD, AliveCore. Thank you so much, sir. The stage is all yours. Once we have the panel set up, we can go ahead.
So, while we are waiting for the speakers to come on, Siddharth, Lokesh, Vishal, without wasting time, let me just give an introduction. When we are looking at technology or anything that is happening related to healthcare, I always say that there are three things that we are impacting. And these three things are, one is the access to healthcare, which has been a challenge in our country until recently, when the technology kind of took over and started bridging the gap between the need for healthcare and the provision of healthcare. And I think technology is what made the difference there. Second is, I speak about the quality of healthcare that we are able to provide and the affordability. And these go hand in hand, because it's not about, we have always heard people saying that, it's an apple to apple comparison, because you can't say that I'm going to provide healthcare, but it's not going to be as good because you're not paying as much. So I think technology is what is impacting these three pillars of healthcare. And today in front of you is a panel which is, of the three people who lead in their own respect the technology that is impacting these three things. We have Siddharth, who's the CEO of Lupin Digital, that is bringing cardiac care and actually helping the hospitals bring quality cardiac care at home and bridging the gap of ensuring that they're always connected. We have Lokesh, whose company AliveCore has got the handheld ECG machines which is actually helping you getting access to your live ECG and it being reaching the doctor where he can guide you whether you can actually you need immediate attention or not. And then I don't think I need to introduce Vishal, who's the founder of Goki, who's brought in the what we call the Internet of Medical Things to people. Because so thank you so much for making it to the conference. Uh, my first question is around how do you think that healthcare related to the IoTs is transforming healthcare? Because the first thing that comes to our mind when we are talking of healthcare is, we have surgeries, we have teleconsultations, but suddenly the impact is moving towards remote monitoring and ensuring self-care, and that is where the IoT is playing a role. So how do you think, Siddharth, maybe let's begin with you as to how do you think it is evolving the healthcare as we see today?
So I think thanks so much for that setup. The overall focus in healthcare, like Dr. Anurag rightly mentioned, is moving towards preventative healthcare. You really don't want the person to end up in hospital. That should be the last line of defense. And that's where I think a lot of investment is happening in remote patient monitoring, where you are able to monitor patients, even chronic patients, from their homes. Classic example is say with heart failure, folks where the heart isn't pumping as much as it should, and there could be multiple complications, but you obviously have to go back home and live your life. So how do I make sure that I'm able to measure your heart activity? How do I measure your cardiac markers while you are going about your activity? We've recently built an application where we can just take a photo of your feet. One of the telltale signs of heart failure is pedal edema, essentially water getting logged in your feet. So your feet swell up. We can actually measure that through sort of taking a photo and AI, and actually convey to the doctor whether he probably needs to increase a diuretic dose or how he needs to treat the patient while he's still at home. I think the incentives especially line up in geographies like the US, where payers, insurance companies actually have penalties for hospitals if there is repeated hospitalization of the patient. Otherwise, there's a perverse incentive where the hospital would love for the guy to keep coming back and insurance to keep paying. So insurance companies are very clear. We'll pay once, and a heart failure patient shouldn't come back in the next 3 months, right? No matter how severe. And therefore, hospitals then invest in remote patient monitoring, remote care. So I think that's the first step. I believe it's a $1.75 billion market already, expected to grow around 18-20% CAGR over the next 5 to 7 years. I think the more interesting play, and that's where Goki and AliveCore and so many solutions are positioned, is actually making sure that you aren't necessarily monitoring patients before an event or after an event. You sort of prevent the event in the first place. And that sort of focus in wellness and ensuring that the patient doesn't come to that point will be quite crucial.
I think that's a very beautiful point that we are moving towards preventive, and the technology is actually enabling the hospital to do that. Lokesh, what is your view on this? How do you think the IoT is changing the way healthcare is being delivered today?
Binder, and I think, I completely agree with what Sid just said. So from our own perspective, what we are seeing is a couple of things. And Dr. Batra spoke about the 3 Ps. I'm talking about the 2 Ps, the last 2 Ps. One is the preventive bit that Sid also spoke about. We've done some, large-scale studies in India, also commercial studies in India, etc., etc. Now, data coming from these studies are telling us that almost 8 to 10% of people walking into a PHC, CHC, health and wellness center kind of a setup need a cardiologist follow-up. Can you believe how big that number is? And I'm not talking about things like high heart rate. I'm discounting all of that. I'm talking about things that could lead to major issues in the future. So when we are doing thousands and thousands of screening programs across the country, that is something that the preventive aspect is coming out very strongly. And I think the next one, which is even more important, is the predictive bit. And I think when we look at a very specialized technology like ours, which is ECG, and all the determinations you can make out of that, but when you combine it with an ecosystem play, for example, that Lupin is building or Goki is building, that gets you potentially to a predictive play as well. And I think that if we can get there through the right partnerships, etc., I think that will be really, really great. For now, even if we can get to preventive, I think it's a huge win for us, and that's what we are focused in India. Just like Sid said, in the US, Europe, the markets are very individual focused. We believe in India is going to be mass focused, so that we can really take care of people's health, especially where access is a problem.
So, Vishal, let me come to you, because the two P's that got mentioned in the last two panelists talking is predictability, because it's only when you know that something might happen is when you can take a action and prevent it. So you're not waiting for the incident to happen. So, and to make sure what IoT does is the data that it collects, right? So my question to you is, how is data and the intelligence around this data, because data itself without the intelligence has no meaning, is helping individuals as well as practitioners to ensure that prevention takes place?
Thanks again. And I think I'll go back to what Dr. Anurag started this session with, that we all know three things: sleep, eat less, and move more. These are the fundamentals of, living healthy. The problem is that data in itself is unfortunately junk. We have too much data already. I have been tracking my life and my health from ever since the first Fitbit came out. So, and all of us in this room already know that whether you should not be eating junk food, you should not be smoking, you should not be drinking excessively, but people still do it. So is it a data problem or is it a motivation problem? So I think what I realized with our years of work around data was that data is good, but the key thing is, how do you use this data to motivate somebody to do what is right for them in any case? And that's when we came to the next aspect of incentives. Incentives drive behavior. What is currently happening is, let's look at sleep. We all want to sleep. Everybody knows that. There are billions of dollars being invested so that you don't sleep. You know who's the biggest company who's culprit of this? Netflix. Netflix has openly said in their shareholders letter, and you should Google that fact, that their competition is sleep. And that is why they introduced the concept of binge watching. All episodes of serials are released at one shot, because they are saying, I don't want you to sleep, versus television, which was appointment television. Second thing, we talked about eat less. I'm sorry to say, apps like Swiggy, Zomato are absolutely ruining your health. They know exactly the time you're going to crave for that samosa or that vada or that ice cream. You will get a notification. Their AI is working on it. They'll give you an offer. And even though you want to be healthy, in fact, you remember their famous ad of eating gulab jamun while watching cricket. So, unfortunately, billions are being spent on junk food delivered to your mouth literally in 10 minutes. वो जो पहले walk करते थे थोड़ा, right? You used to go out to say, at least let me buy bread and eggs and whatever, from the kirana store. Now there are companies who are saying, forget it. I will deliver to your home, and now soon somebody will say, I'll put it in your mouth also. So what is happening is billions are being invested on making you unhealthy, sick, and lazy. And the challenge which all of us face is, we have the data, we can tell you कि आपको heart attack होने ही वाला है, हमको पता है, but why are you still doing that same behavior which you should not do? And I think the answer there lies in incentivization, gamification, motivation. And I mean, of course, we'll discuss this further, but all I want to tell you is, how many of you remember cashback? Paytm started it. That's what made people start using digital payments, not because they were digital apps so hazard the, but, and that is what the incentive of saying that, अरे आप ऐसे क्यों पे कर रहे हो, उसको पेटीएम से पे करोगे तो आपको ₹5 वापस मिलेंगे. So suddenly the consumer started thinking that, hey, I can benefit from this behavior. And the rest is history as of today on how technology of payment has really become so interesting. So similarly, I think in health, while we are building the technology, the incentive layer, and I think we are hoping that the government with the health ID will create the right incentive layers for all of us to then use this data to make them healthy.
You know, I completely agree with you that, just data itself is not or will not help. There has to be some kind of a motivation. Now, whether that motivation comes as a self motivation or it is being told to you what needs to be done. And when we look at healthcare, it is the delivery institutions that actually make a difference, because it's the doctor, when he tells you that this is what you need to do, is in all probability that you will take that action. And this is usually a response to what is happening inside your body. So Siddharth and Lokesh, my question is to both of you. You may, whoever wants to go first. What is the acceptability of these remote monitoring devices, apps, etc., by the healthcare delivery institutions and the doctors? How do they see you as a partner which is going to help them build their practice better?
I think it's an interesting challenge because most of the providers in India are now listed companies, and therefore, while as much as they would love to focus on the long term, there is also a quarterly focus that each of them have, right? So it's not an obvious yes, I will invest a lot of money in things that may give dividends in the future. But I think there are two interesting threads, and then I'll request Lokesh to please add. One is you see the sort of early adoption um, from from practitioners who want to be seen as bringing the best in the world to India. So the kind of adoption that you've seen, and this is the IoT that we perhaps don't think of as much, but the IoT that's involved in pacemakers, for instance, or the IoT that's involved in insulin pumps, right? Where these are devices which are constantly tracking your markers, which are able to up titrate in the case of a pump, or in the case of a pacemaker, are able to actually change the configuration of the pattern, is quite stunning, right? And you have a significantly higher uptake amongst Indian practitioners than perhaps even globally, right? Because there is that hunger, there is that wanting to be a global pioneer in this space, and therefore we have seen that, and I think you will have that at one end. Obviously, the nature of technology is that typical S curve where, having been adopted, you will start seeing it getting dissipated through the society, and more practitioners taking that up. So I think that's one space where we are seeing definite adoption. The second one essentially is where you're, again, like Vishal mentioned, you're able to align incentives with the hospitals. If a hospital is able to see that because of a patient engagement platform, the patient stays with them for the next 12 months. Typically, what ends up happening is there's a very common phrase in the hospital industry called loss to follow up. More than 60% of patients are lost to follow up within 6 months, which means after 6 months, they're no longer following up at their primary hospital. They go shopping around, they go to a GP because who will pay 2,000 rupees for an OPD consult? I'd rather pay 500 bucks. But if there is a solution where the hospital is genuinely able to take care of the patient, handhold them, reassure them when required, do diagnostics, etc., a single point solution, the patient feels that love, the patient feels the connect with that institution and wants to go back there for checkups. He understands that the institution is not necessarily pushing me for OPDs unnecessarily, but only when required because my vitals went a certain way. In a way, that's what we are hoping to sort of provide as well. But I think independently, hospitals have reached this kind of conclusion. Insurance companies, I think, are another institution where there is interest in managed care, but hospitals are perhaps the most obvious candidates to take this up because the patient is under their care. But I'm sure Lokesh would. Sure.
Yeah, Lokesh, before you answer, I'd like to also get your perspective along with this, because, we are in the business of healthcare. The whole ecosystem has to work together. And we know that when you're looking at GPs, who could be your first point of contact if you feel some pain or something not going wrong, when you go to them, despite having all these devices with them, most of the GPs or physicians are unable to read the ECG that comes out, you know. So how do you, and I know that you work with the ICUs of large hospitals, how does this typically work where hospital also benefits from this device as much as the patient who may not be coming to the hospital in the first place?
So absolutely, Arvind. See, these are very important points because the hospitals and the doctors are they are serving a need for the people. They are not in the business of, for example, in our case, they're not in the business of selling devices. So, what is the service that the doctors can provide based on a tool, which is, let's say, us, that they can give to their patients or they can use, in various kinds of settings. So the articulation of the value proposition I have learned over the last couple of years is extremely important. You can't just say that, take this device, give it to your patients, use it. But the thing is, how does it help them? You have to think through all of that and explain and have that discussion with them. I've also seen that, the for example, we mostly work with cardiologists. The biggest names in cardiology are more receptive because they have probably got more exposure, having been through multiple conferences, seminars, not just in India, but in multiple countries. So they've seen how technologies like ours can support their service, right? So that's very important. What we are also seeing is, just like you said, people don't know how to read an ECG. Let's say for a GP who's in a small town, you can't even expect that person to be able to read something like an ECG. So I go back to my first point that more and more we are seeing small towns, cities, villages, public health programs starting to use technology in a much larger manner than being used in large cities. That's at least the case with us. And the reason is that you spoke about data and intelligence, that at least they are able to figure out if this person's rhythm is normal or not. At least the first level screening is done. Then they can say, hey, listen, now you should go and talk to a cardiologist, whoever. And multiple kinds of use cases are suddenly appearing out of nowhere, like tuberculosis. I mean, I can go into details, but we didn't have any idea that something like a tuberculosis in India, which is, quite an issue, needs ECG monitoring. And what within ECG monitoring? How can we support that? There are use cases being developed around hyperkalemia, high potassium levels, etc., which apparently can be detected using an ECG. So very interesting things. But I agree with you that we have to kind of work with hospitals and providers, tell them how it makes sense to them.
I just want to add one thing to this. It's very interesting when you actually ask hospitals and provider what is their metric of business, and the minute आपको समझ आएगा, you'll understand why these things are not working. Remote care, teleconsult, technically everybody should be doing, but the reason they are not doing it in as much is because for them the KPI is how many patients are walking into OPD. Hospital measures the entire hospital ka, so many patient came and then X percentage did diagnostics, X percentage did this, they did this. So the funnel of a hospital is person walking into the clinic. And if you're running a business, all these are listed companies, they can't be cutting their funnel and saying, please don't come here. So the idea here is that I think hospitals need to go up the value chain. And if you look at models like Kaiser in the US, where the hospital's funnel is no longer about how many patients come in, but what is the outcome so that the overall cost of healthcare reduces. That is the real game which is going to incentivize the entire system to do this. And which is why, just to give you an example, we went and partnered with insurance. So one of our partners is Kotak. And we said, let's incentivize the hell out of the customer to say that if you are healthy, we will give you a benefit which you can't imagine. So what we did, and I'm just summarizing this, imagine that you are just paying a premium for 1 lakh, and based on your health data, the premium jumps to 5 lakhs. And this particular customer, and we have real claims data now, the actual hospitalization is 15% compared to 85-90% of normal people who are getting hospital or claims not hospitalized. Why? Because the person on the other end, if they are just doing basic checks, the problem in India is that nobody does a simple BP or ECG. जब तक उसको हार्ट अटैक होता है उसके बाद में ये सब करते हैं लोग, और पता चलता है कि अरे यार your heart is 40-90% blocked or whatever. This should be done before, and that is the behavior we are trying to incentivize. And similarly for a hospital, the model needs to be that how do they benefit from this remote, and not for their team, business team, that oh, because of this actually my overall business has gone down. That's the problem in the system.
This is a very interesting point that you brought up, and I want to discuss this. That do you think the hospitals actually see you as partners, or do they actually see you as competition? Anybody who wants to go into this?
I mean, not us, absolutely. We are not in the business of providing, patient care like the hospitals do. We see ourselves as a tool that helps doctors improve their productivity and improve access to care. So, not us for sure.
I think there is always a tendency to treat someone as potential competition. But we've seen in the dialysis space, right? You've seen one company sort of provide the service to several hospitals. And I think they were able to do it by showing that either they could run it profitably or the hospitals could make a loss on it, right? So if you've picked a fairly niche specialty where you know that the hospital and the hospital themselves knows that they will not be able to make the kind of investment it takes, right? You are in the health tech space. We have 50 people sitting sort of 10 kilometers from here who are working on algorithms, who are working on intuitive sort of patient interfaces, which a hospital knows that they will not be able to do. So I think if you're able to demonstrate that value to them, and the fact that we promise that Lupin will not open a hospital, right? So we are not going to be in a competing space. Then it sort of makes sense to several of them. But it has to be a niche specialty. It has to be something where you can go far deeper than they would ever want to. And it shouldn't be such a large TAM or target available market that they would want to do it themselves. So I think it's a little bit of finding the right space.
Conflict of interest part, right? That who's your customer? Is the hospital your customer? Is the doctor your customer? Or is the user? And I'm not calling this person patient, because 99% of my users are not patients because they are not sick. So we in fact call them players. And as you know, Khiladi Akshay Kumar is also our brand ambassador. So we are saying that you're not sick. Your sickness is episodic, right? You maybe get sick once, twice, thrice, 4 times a year, and usse zyada hai, then to you have a serious health problem. But out of 365 days, let's assume you are sick for 10, 20, 30 days. The rest 330 days is what we are helping the people. That's our pitch to the doctors and hospitals. And my point is that the minute the person steps out of your clinic, who's taking care of them? So we are positioning ourselves as a partner, not competing with the patient at all. In fact, we are saying that patient agar aaya to we'll bring them back to you, because we are not in the business of patient care. We are in the business of making sure वो patient ना रहे, and अगर जैसे ही आपके hospital से बाहर जाए, who's taking care of that person? So that has been our pitch, and that has really worked, because the minute, and everybody is running a commercial organization, the minute they feel that you are going to have a negative impact on their business, clearly they will not be interested in promoting you. So the partnership approach really works. And we did a similar partnership with none other than NHS in the UK. So UK has now implemented our system because their incentive was that they want patients to be remote cared, and because you just can't get appointments in the UK. So there is so much of problem of capacity. So we are actually helping them, saying that if there is a person with a non-communicable disease, we will make sure that they are outside remote care, so that they are not becoming a burden to your system. So it's all about figuring out that what is the incentive the system is seeking, and then delivering that, but representing the interest of the player or the user in our case.
Vishal, you spoke about incentives, and prior to that, you had also given an example of how Paytm started and they were giving a cashback. You come from a background where you've dealt with users, engagement, you were into gaming space. So you have a fair knowledge about consumer engagement, right? How are you positioning your IoT product in such a manner that it cuts across the barrier of affordability and incentivizes them and remains the user remains engaged without feeling the burden of the money that they're spending?
That's exactly the point, right? We first thought that who are the people who are spending on healthcare who will be interested in this picture that we can help them reduce their spend. So it's either governments or it is insurance companies or employers or people who are self-employed. Between all of us, either your company is paying for your insurance or you are self-paying or you are covered under some government program. These are the three ways, or you are not insured at all, where you are paying out of pocket completely. So our entire story is that how do we go to these four stakeholders and convince them that this solution is going to incentivize them, and instead of spending money on medication, they can spend that money on good food, experiences with their family, on healthy living, on going to a gym, on walking. So we are not saying that you will not spend money, but we are saying, would you rather spend that money sitting in a hospital bed and having all the bitter medicines, or would you want to do that living a healthy life? So that has been the pitch. And one thing which we just announced last week in Singapore, our partnership with the Force of Good Foundation and Animoca, which is in the Web3 space. So they are actually launching a healthcare token, which is going to be a fungible token. So think of it like the airline rewards equivalent for healthy living. So you could start earning these tokens, which is going to be called UHT, Universal Health Token, by your health data. And then you can use these tokens on health food, gym, insurance. So all the people who want to incentivize you to be healthy will say, I am willing to accept this. So it creates this network of people who are rewarding you for health and incentivizing you. Of course, McDonald's will not be allowed to use this, or all the Swiggy and Zomatos of the world. But yes, if there is a brand who says, I am delivering healthy food, they could be part of our network accepting this token. So we are trying to create that kind of a network. And similarly, that token holder could use the Lupin app or the Alive Core, because that person is earned that token by proving that they are coming from a preventative mindset. So we are working on something like this. So hopefully soon.
So, before I ask my last question to the panel, I want to open up to the audience to ask a question, because the whole idea of putting across this conference is to benefit the people who come and attend this. So if you have any questions, I'd rather allow you to ask a question. Anybody who has any questions? Yep. Please introduce yourself and let us know who you are addressing the question to.
Yeah, my name is Arindam. We run a established startup for cardiac care, preventive health check. My question to you, as we already told, that hospitals are measured by a revenue per bed today, and also OPD to IPD conversion and number of footfall. Now, in that perspective, when you go with a preventive health, what is the motivation factors which can generate? Because in this case, your healthcare delivery partner has to be your partner at some point of time. We can't shy away from that. Insurance can be one, but if I more consider Indian current scenario, your healthcare delivery big guys who are listed and everything, they has to go. So what can be their motivation to partner with preventive health?
So I think that's the problem, right? I mean, what I believe, again, I don't know your business, that if you think about your business on what is hospital or what is pharma company or what is doctor thinking, you are actually thinking it the wrong way. You should think about what the person, the patient is thinking. And the first thing, if you ask anybody, they'll say, I don't want to get sick, I don't want to go to the hospital. So the person who is on the other side, for them, hospital is not a great experience. Nobody is waking up every day morning and saying, I'm going to go to the hospital today. The second thing is, while the cardiac and all the diabetes, all these are how doctors and hospitals look at patients, but users don't say कि मैं cardiac के लिए जा रहा हूँ या मैं इसके लिए जा रहा हूँ. As a consumer, you don't think of yourself as organs, but medical profession always has, this is kidney doctor, this is heart doctor, this is brain doctor, but you as a patient don't think about yourself. So what is the motivation of the person on the other end is most important. So for example, we took one motivation of, we will help you become younger and healthier version of yourself. So on Goki, we don't show you your weight or anything else. Of course, you can see that. What we show you is your age, how you are becoming younger every day. So the metric for the user is not all these parameters, but it is your age and become younger. And we actually have a meter which shows pace of aging. Is your pace of aging very high, or your pace of aging is, you are kind of getting on the other side. So it is all about understanding the motivation of your customer. So if it is the doctor and hospital, then understand their motivation. If it's the customer on the other side, understand their motivation, because otherwise you'll always be stuck in this problem.
Thank you.
We can take, Dr. Batra.
Can we get a mic to him? Mr. Prasad, can you give us some numbers, data on the impact you had? For example, if 1 lakh alive for, maybe 1 million, I don't know the number, were installed, how many people used it, how much of it saved lives, so to say, it prevented where, if you can share some data.
Sure. So, Dr. Batra, the numbers look like this currently. Our devices capture approximately 5 million ECGs a month. So that's the number of ECGs that are being captured every month. We have approximately 800,000 active quarterly users. We sell approximately 60 to 70,000 devices a month currently. And I'm talking global numbers, not just India. So if you look at all these numbers, so if you look at 1 month data of 4 million ECGs, approximately 5% of those show up as abnormal. So how much is that? A million, 5%, 50,000? So 50,000 ECGs show up as abnormal. So we would like to think that those 50,000 ECGs help people take better decisions about their health. So that's the kind of scale that we are talking about. So it's and the other thing, one of the things I'll mention, so very, very short, short manner, is it's extremely important for us to work very closely with doctors, hospitals, not just for commercial business, but for making sure that our use cases, etc., are properly established. Clinical research is probably what is really lacking in the medical devices space. And so one of the things that we do very, 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 knowingly and is clinical research. More than 200 research papers published in peer-reviewed journals. So unless you do that, doctors, etc., don't really get the confidence in your technology. So I think that's a huge differentiator, especially for us.
Hi.
I have one more question.
Yeah, I have a question. Keshmurthy from Deshpande Foundation, mentor for startups. When you talk about IoT for medical, what comes to my mind is what is the level of utilization of technology in hospitals? For that, we need to increase the number of startups. So to identify the various problems or the hiccups in utilization of technology in hospitals using startups. We have a few startups already, but I find that the apps like, for example, Cardia is there, which will tell you the BP and arrhythmia, the heart rate, etc. Now, how much of it is being used for monitoring the patients? More of it, most of the time, we see that the patients are not being looked at as assets, in the sense to generate medical health data from the patients there is not much of a technology utilization as of today. So we need to identify number of startups in that area and give it to some of the foundations like ours, where we can sort of increase the technology content in the hospitals, so that IoT or medical will take a front page. Thank you.
Thank you.
Hi.
Any comment on that? That was a comment. So, last question, I think, because we are running out of time. Yeah. Yes, ma'am. Ma'am, your mic is not working, so can we just sort that out?
I'm an ophthalmologist with 20 years of post-PG experience dealing with patients directly. And last 8 years, I've always also been part of some health tech companies which are developing fundus cameras for retinal screening in the preventive areas, AI-enabled cameras. So you can say that I belong to multiple worlds, but both sides. So I have like one input and maybe one question. So one input is that, like there was a question that are you giving solutions for the patient or client or end customer, or are you being a service provider for hospital? So that disparity is always going to be there unless we try to plug and play. Mostly the doctors feel threatened that the patients are being taken away from their control, or the patients will be taken away. But at the same time, like you said, veteran doctors who understand that this is a way to triage and let them do their own specific work and improvise on their time, get more productive while the patients are being brought to them early. That's a very good way of looking at it. So, such solutions probably for long-term sustainability, they have to go hand in hand. Like everybody has to be in it together. So another thing is that most of these problems are now being addressed for urban population. And how are we even going to, urban and maybe semi-urban, how are we even going to get it to the rural areas? Because training in terms of use of technology, the language barrier, so all that needs to be addressed. So how are you all going to look into this issue is what I would like the esteemed panelists to answer. Anyone can take it.
I'll just give a practical example of how it worked for us. One of the critical success factors internally for us is what we call vital adherence. Essentially, people taking their BP readings and taking their weight readings in case of heart failure at the desired frequency. We want them to take it at least once a week for BP and at least once in 3 days for weight, right? And we did a beautiful trial with the Jayadeva Institute in Bangalore. We were looking at young MI patients, so folks below the age of 40 who've had heart attacks. And given the nature of Jayadeva, the patients all come from economically weak backgrounds, and they all come from outskirts of Bangalore, right? So they're not necessarily staying in Bangalore. They would have come for episodic treatment and they would have gone back. The idea was to try and do a trial with them and try and drive adherence, reduce readmission. The single biggest needle mover for us was using WhatsApp to record vitals, right? The patient may not be perfectly comfortable with the app, but if you ask them simple questions on WhatsApp, what is your BP, type 140 by 80, as an example, folks will end up punching that number. If you tell them that it is time to take your medicines and then message them half an hour later saying, have you done it? They will say yes or no, right? So I think the whole point of digital is that you should be able to extend beyond where physical reach is possible. Otherwise, hospitals serve urban areas perfectly well, right? And I think there are, this is just one example, but I'm sure there are multiple other innovations as well.
By saying that, look at what happened in the financial space. There's not even one bank whose app is there in any major percentage in UPI. We use Paytm, PhonePe, Google Pay, etc. So similarly, in the world of health, disruption will not happen by the incumbents. The hospitals, while we all can expect them, wo karenge, the reality is innovation will happen at the startup level and at the consumer level. At least that's what I personally believe, which is why we spend disproportionate time with consumers and figuring out what is going to motivate them, because they will change the behavior of the entire system, which is what happened in the world of fintech.
So I'd like to close this panel, but I'd like to share something that opened up for me when I was listening to all of you, and especially the questions that were being asked. And that is that it's time, like you said, it's not going to be coming from the incumbent, it's going to be coming from people who are thinking differently. And one of the ways to think differently, if you go back to taking off your healthcare cap and see what is it that I'm going to do to serve the need of people who need it. Think consumer. And that is a time when you will start looking at creating something which is going to disrupt the space, because the moment the word patient comes in, the perception is that somebody is unwell. So that's the first thing. And second thing is that I've always believed that there is one part of the ecosystem that just went missing in the last 2 decades, and which is the family physician. The person that you would go to, who would measure your metrics and then will guide you who to visit, who to take, which specialist to go to. And I think absolutely, but when I'm listening to what technology is doing, I think technology is replacing your family physician, and this technology and this family physician is either in your wrist or on your arm or wherever, but the family physician is with you 24/7. And that's the beauty of how technology is uh, disrupting and bringing efficiency to how we are going to live healthy and may not need to go to a hospital in the first place itself. With that, I'd like to close this panel. We have a blaring red screen in front of us saying time's up. And so thank you so much for being a great audience, and thank you so much, presenters.
Thank you so much for the lovely session and insights. I'll request you all to kindly wait, please. We have a group photograph in place. Thank you so much. Loud cheers, ladies and gentlemen. Love it. And just by the way, I think some really interesting points on preventive healthcare measures. Prevention is better than cure anyway. And I like that point about being lazy and not going out. So I just actually was sitting there and I deleted one food delivery app. So I'm not kidding when I say that. Thank you so much. So we're all set and getting ready for the next session. Just kindly give us 2 minutes for that, and we'll be ready with the next one. Request the team to kindly let me know when we are ready. Till then, please take your time. And I hope you all are having fun over here, ladies and gentlemen. आपको मजा आ रहा है कि नहीं? क्या बात है? Even such constructive discussions can also be engaging and fascinating, right? So, are we ready, Sanjana? Lovely. So moving on, the subject right now is in focus, building sustainable hospitals. This session will be throwing light on the need of building sustainable hospitals, the initiatives taken by hospitals and companies working on different aspects of hospital infrastructure for a greener tomorrow. For this, may I please have the privilege of calling upon stage Ms. Manisha Kumar, Regional COO, HCG, for a session. Thank you so much. It's a pleasure to have you. And she'll be joined on stage virtually by Dr. Karan Thakur, Vice President, Sustainability, ESG and Public Affairs, Apollo Hospitals Group. Thank you so much, sir, for joining.
Thank you.
So, ma'am, the stage is all yours. Please go ahead. Thank you.
Yeah. Thank you very much, Businessworld, all the blog everybody here, and also Dr. Karan for joining online.
Thank you.
For a very important topic, which is building sustainable outcomes. Sustainability today is such a big global focus uh, across the world, across industries, in the wake of climate change and crisis that the world is facing. There are global mandates for large corporates, Google, Amazon, Microsoft, and so on, to move to net zero energy ratings, to keep reducing the carbon footprint so much so that even the vendors that they must deal with, even the office spaces that they rent in India have to be ESG. And why must healthcare be left behind? Healthcare industry is one of the largest and fastest growing in India. 80% of the healthcare industry is hospitals. About 1.2 and for hospitals are very large enterprises, 24 by 7 running enterprises. We use substantially more resources, more energy, and create much more waste than any other commercial building of a comparable size. Therefore, it is so pivotal for hospitals and healthcare industry today to take on the journey of sustainability, to become more and more environmentally conscious, and to work on reducing the large environmental footprint that we have. With this, I request Dr. Karan to set further context on the topic and also talk about some of the global trends in sustainability that healthcare industry across the world is seeing today.
Right. Thank you. Thank you for that introduction. Thank you also to Business World, and my apologies that I am not there in person. But Manisha, as you said, you've laid the context very well. But I'd like to take a step back and look at climate crisis is being contributed through human activity, and it's anthropogenic and it's real. And it's important to underscore that because there are often debates that erupt about how much of it is natural and how much of it is being attributed by humans. But I think the science is very clear. On top of that, you see the impact of the climate crisis is directly on human health, whether it is air pollution, water, biodiversity loss, migration. Issues around the climate crisis are actually embedded in health. So the climate crisis is a health crisis, and I think we should start addressing it like it is dengue in the winters, or a changing pattern of malaria, which is being seen in places up till now that was not being seen. Similarly, air pollution is causing respiratory distress, and today there isn't a city in India and very much part of the world, any part of the world where you will not find air pollution leading to being a direct cause of human distress, especially on respiratory illnesses. At the same time, it's important to understand that while the climate crisis is the health system itself is also contributing to the climate crisis. Last year's the Lancet Countdown report on climate change and human health actually put the number that the health sector contributes to global emissions to be close to about 5%, just over 5.1%. If you compare that with any other sector, for example, shipping contributes to about 7 to 8% of all global emissions. So the healthcare sector is a large emitter. If it were to be a country, a standalone country, it would be the fifth largest emitter in the world. So currently we're emitting about 2.7 gigatons of carbon dioxide equivalent into the atmosphere annually. And therefore, the need for the health sector also to come and step forward and really look at ways by which it can reduce its own carbon footprint, and also look at ways of substituting the current practices, the current use of materials, and also our entire way of operating in the built environment to ensure that this footprint reduces in the years and decades ahead.
Right. Thank you, Dr. Karan. And just to add to that, aside from the benefit of being more judicious and transparent in using Earth's resources, there is also an advantage of ensuring long-term viability and a lot of financial benefits that are also there of building sustainable hospitals. We know that there are a lot of global funds, multilateral funds, even sovereign funds that are now that have a mandate to only invest in companies, including healthcare companies that are ESG compliant, that have sustainable practices. There is also green credits that are a very common structure outside India that are very commonly traded, and that's a huge financial incentive to adopt sustainable practices. In the budget of this year, 2023 annual budget, it has been proposed to be launched in India as well, a green credit program to similarly incentivize corporations in India. So that's a big benefit as well. Now moving on to some of the practices that hospitals can do, are doing in this view. And just to start with my personal experience, when I started one of my previous greenfield hospitals, it was a multi-speciality hospital, but the good thing is that we did a greenfield and we were able to sow the seeds right at the start. So right from the design phase, we were able to instill a lot of sustainable measures from the time we, just like buying of raw materials. So we got sustainable raw materials which were either recycled or reclaimed. We were able to put energy efficient lighting, HVACs, chillers, VFDs on high running equipment. You're able to also optimize on building orientation to get more natural lighting, to get ventilation, and also newer but a very now increasingly becoming common thing is of integrating advanced workflow optimization. So right at the time of design of the hospital, putting an optimized workflow in the design, in the blueprint of the hospital. By an optimized workflow, I mean both in the patient centric, in the frontline areas, as well as for back-end processes, looking at synergies of all the processes, how the loops are closed, so that there is efficient use of resources, there is improved employee productivity, there is less use of energy, and of course there's saving on turnaround time and operational efficiency, which in turn saves cost for the enterprise. There is also simulation tools that are available. I remember we used a simulation tool to be able to make a operational workflow that leveraged the tool, and then we could implement it in the design when we firmed it up. And we also used energy management system. There are a lot of tech-enabled tech platforms that help project managers to better use energy management during the construction phase and right after it. So all in all, so many initiatives, and there's a lot more. I've touched on the high points that can be taken, and which hospitals are taking, large hospitals like us, in building green fields, so that we are able to put it in the DNA of the hospital right at the start, and from there on it's an easier journey. And turning to you, Dr. Karan, would be great if you share some of the sustainable practices that Apollo Group has taken for running hospitals, and some of the ones that you're looking at to implement in the near future.
Right. So we have an ambitious agenda as part of our Apollo Sustainability Action Program, ASAP, and we put our commitments out there. Currently, we're using about 19% of all our energy sourced through renewables, and we've committed to upping that to 25% for across our value chain, which includes the pharmacy division, the hospitals, and the clinics, by 2025. Further, we've committed to upping this to 30% by 2030. So 30% of all sourcing for energy, which includes purchased electricity, which is part of our scope 2, and also energy that we may be sourcing in terms of fuels, is going to be from renewable sources. As a transition, we have moved away from high carbon fossil fuels and have transitioned into LPGs, and now we're going to be moving to the renewables or even low carbon versions as we transition. That's on the energy side, and there are complications around how much you can actually source, given that there are regulatory constraints around that. But within you spoke about, we've implemented a lot of low embodied carbon materials, both for our new builds and also for our retrofits. But a lot of it also is built into the, like you spoke about, VFDs, the HVAC system, cooling tower efficiencies, etc. But a lot of it is also to do with practices at the patient-facing end. For example, we did a study and we found that if we increase the ambient temperature from 20 degrees to 24 degrees, which does not really impact hospital infection or patient comfort, we could actually accrue savings up to 24% in our energy consumption and use in many cases. Now, obviously, where there is sensitive equipment or there's a patient, you'd have to sort of temper that. But the point being that with building management systems now in vogue, we can actually make these small tweaks and accrue very large, benefits. Similarly, for our dialysis department, we know that each dialysis takes anywhere between 150 liters to 200 to 250 liters of water. We are actually using the discharged water back into various non-clinical processes so that it can be recharged and reused. Similarly, we've got targets on waste reduction and water consumption. Currently, our big hospitals, 18 of our big hospitals, are reusing about 25% of the water into various functions like HVAC, cooling towers, etc. We are wanting to up that to 50% over the next 3 years, and we have a plan in place for that. Similarly, for waste, again, it turns out to be a slightly tricky issue. But as you, in your opening remarks, you said we are a large generator of biomedical waste. India creates about 56,000 tons of waste that very little can be done with. And we are looking at a 10% year-on-year reduction from our 2019 to 2020 baseline and accrue that by 2030 to have a significant reduction in our biomedical waste practices, and also how we're going to be using that when it is going to a landfill. And we are hopeful that there could be newer technologies that come along the way where we can actually treat some of that waste that is generated, hazardous waste, on site before moving it to the landfill or for incineration.
Thank you. Very valuable insights, and great to know everything that Apollo is doing. Just to add a couple of points to this, I think as hospitals, it is also our responsibility to instill a culture and inform, educate, and inspire everyone to follow the principles of reusing, reducing, recycling. And to that effect, some very hygiene basic things, but which go a long way in setting the right culture that we can do is, restricting the use of disposables, whether it is in medical areas and consumables, accessories, and using reusable items as much as possible, minimizing toxic chemicals in cleaning, even in operating theaters, and substituting with more organic products. Putting sustainable food practices. The hospitals are very large kitchens. We, make food probably for 500 plus people 3 meals a day. And so, having a concept of farm to table, procuring organically grown, sustainably grown local produce from local farmers that also supports the local economy, but is sustainable, is beneficial for patients, managing the demand and supply to reduce pilferage, having tie-ups with local shelter homes and charities so that the excess produce not wasted down the drain but can be donated. So small actions like that go a long way in creating the right culture and right impression, and sending the right message to everyone on the front lines that work in the hospital. Um, Coming back to implementation, you listed so many best practices that Apollo is doing. I'm sure a lot of large hospital groups are also looking at adopting many of these. What are your thoughts on driving governance around ESG, around sustainability? How can large hospitals like ours have rigorous governance around sustainability and make sure the implementation cascades across the network?
Yeah. To your previous point, I think you've raised a very important issue and set of issues. One is that we have the benefit of the Indian mindset is towards saving and conscious consumption, and I think that needs to be tapped onto in our operating milieu, even when we are looking at sustainability. And there are quick wins, as you said, and then there are strategic moves. For example, we know that reducing the consumption of meat will have a big impact on methane production, which is a very toxic GHG that is emitted every year. And again, we find that although not all of India is vegetarian, but there are pockets where it is encouraged. And I think that is something that can be, we can move the needle on, which will have direct benefits on human health and also on animal and planetary health. Coming to your point on governance, any good sustainability program or a program around ESG disclosures needs to be rooted in very good governance. For example, at Apollo, we have a board level committee which is looking at sustainability. I report to them, on the aspects of sustainability where we have acted upon, and also seek their guidance. So the CSR committee, which was previously mandated with aspects of our corporate social responsibility, now doubles up as the CSR and sustainability committee. Now, what that does is it really drives action from the top of the organization to folks like myself to really drive this on the ground with leadership across our three business verticals. We've also put in a very strong sustainability council, which has representation from all our businesses and ensures that what the board wants is actually created into bite-sized programs and are then implemented on the ground. For our hospitals divisions, for the large 18 hospitals, we have green teams, and these are multi-dimensional teams which have representation from clinical, nursing, quality departments, and operations folks, with supply chain and HR, to really drive some of the goals that we've set out for ourselves. Those are some of the aspects around governance which are important, but structurally, it's very important to have a cadence which works from the board to the patient-facing areas and backwards. We've seen that whenever an organization has identified a sustainability need or has had a formal governance structure, the success rate of sustainability programs can go upwards to by 75% to 80%, and there is research on this. So first and foremost, I think along with measuring and building good operating systems which can measure the impact that we have, it's going to be critical to build governance so that there is a cadence and there is a structurality to sustainable practices. Because yes, hospitals do a lot; they might do in bits and pieces. The importance of tying this together and having good governance cannot be underscored more.
Well said, Dr. Karan. Echo your thoughts. And just to close, I think our time's up, but governance for sustainability in hospitals will really, as you said as well, has to be driven from the top, right at the board level, but drilled down and imbibed by all the employees. And it is important to set processes, set norms, mandates, but also walk the talk, whether it is use of electric vehicles to do inter-hospital transport, observing Earth Hour, sustainability hour every once in a way by dimming lights and minimizing usage of resources, reducing usage of paper, inculcating, reusing, reducing, and recycling as motto and mantra across all employees. That will go a long way in creating sustainability as one of the pillars of running hospitals, setting up hospitals, and really instilling it in the DNA of future hospitals. Thank you, Dr. Karan. Thank you,
Thank you.
organizers. I'll close here. We're available for anything.
Thank you.
Thank you, Ms. Manisha. Thank you, Dr. Karan. We still want a photo for this one as well, just because it's virtual. ऐसा नहीं है कि photo नहीं लेंगे. Let's have a photo for this one as well. I love that smile. We have to capture that. Come on. And let's clap, ladies and gentlemen, please. This is a festival. Let's show some energy. और जोर से तालियां, please. तालियों की गूंज जो है वो एयरपोर्ट तक जानी चाहिए, if I can say. Thank you so much. We're all set to get ready for the next session. Let's just give the team 2 minutes for that. In the meantime, till we have the setup ready, does anyone have any question? Does anyone have any suggestion? Any feedback regarding how the event has been so far? Anyone wants to say anything? You can raise your hand and point out if you want to say anything. किसी को कुछ बोलना है यहाँ पे? Okay. So I believe everyone is very happy. Let's speed up a little bit, like just 0.1%. Are we ready? Superb. So moving on, the next discussion right now is on the subject, a conversation to the new healthcare landscape, understanding the need for continuous learning for healthcare professionals. You never really stop learning, right? So the more you learn, the more you get better. The healthcare landscape is fast evolving. Keeping in mind the need of evolving further for career growth, what are the measures that are being adopted and can be further added to build more efficient and effective healthcare professionals? And how hospitals are further helping both medical and non-medical healthcare professionals in building their career paths? These all points are all set to be discussed. May I please call upon stage Ms. Srinivas Kannan, Director, Aster Health and Academy. And alongside her, may I please have Ms. Devika Parekh, Manager, Learning and Development Group Head, Care Hospitals, on stage, please. Thank you so much, Mr. Srinivas and Ms. Devika. The stage is all yours. Are you set and ready? Thank you.
All right, so learning and development is one of the most, my favorite function, because I'm heading L&D for Care Group of Hospitals, and we've been doing multiple initiatives here for our medical as well as non-medical team, and it is functioned into different aspects like mid-management, senior management, and also the junior level team. So we also have learning management systems through People Strong, and there are a lot of things that we can do in terms of learning and development and helping our team to develop across and to ensuring them that there's some career path for them. So I would shoot the first question to you. Yeah, how is technology helping in healthcare education and training?
I think that's a good question to start off with. First of all, I just like to sort of set expectations. Technology is a means to an end. Technology is not an end to itself. But technology definitely in today's world, thanks to COVID and how the world has changed, whether it's your finance, your telecom. When was the last time you visited a post office? When was the last time you visited a bank? The world is changing, and so you can't really absorb yourself with technology. It's becoming an increasing part and parcel of our life. From a healthcare education perspective, I think it solves three major problems, and in most contexts it does the same. First is access. In today's world, people are busy. Everybody has busy lives. They want to have the learning when they want, where they want, in the form they want. So it solves the access problem. Second is equity, right? Not everybody gets access to everything every time. There are lots of moats or barriers for access. So LMS or technology really solves that problem. And the third thing is, big initiative is around personalization. Technology with AI and many things that, the tools that are part of these LMSs and other technology initiatives really help address these. And I think, increasingly newer and newer technologies, as they get integrated and become sort of more mainstream, like virtual reality, augmented reality, AI-driven systems, all of this push the boundaries. It can never replace a traditional classroom or hands-on learning, but it does bridge the gap to the extent possible.
I totally agree with you, because there's so many times wherein the nurse when we have to train the nurses, the nursing educator is like, hey, madam, please make sure that you give a session which is in person session with some role plays and some realistic question answer round. Otherwise, they're not actually able to understand. But when it comes to, say, senior management, we can still have some sort of an online learning system. So that really helps. And as care hospitals, we've collaborated with ASCII Administrative Staff College of India, and they run a very good program for us for mid-managers by the name of Care Emerging Leaders. So that's going really well for us. So as you told very well, that technology is not everything, but yeah, it is something that we're going to focus on in the future. Correct.
Yeah, thank you.
So. All right. So moving on, what as per you is the importance of continuous learning for both medical and non-medical professionals?
So again, I raised the point of how the world has been changing, and especially in the last one generation, I think the world has transformed far beyond what change the world has seen in the last maybe 200 years. For example, the postal service has shut down telegram as a service. I'm not sure how many people are even aware of it. So there is change, but as industries or domains, there are two industries that are most difficult or to see breakthroughs and adoption of new things. First thing is healthcare, and the second thing is education. And now, when you're at the intersection of both, the landscape is extremely tough. Obviously, lives are at stake. People's careers are at stake. But what really happens, between your college days and your formal learning phase of life, and then in real life, is, where do you get the opportunity to update yourself? How much do you know about what's really happening today? Becomes a big question mark. For example, in any typical college today, how much are they exposed to robotic surgery, laparoscopic surgery, or AI-driven methods for problem solving for clinical or non-clinical scenarios, is almost non-existent. Now, unless the entire fraternity, depending on the role, position, experience, are given the opportunity to understand what's happening today, what the customer really expects, to give the best in terms of outcomes. If there is no forum or opportunity to do it, then the loss is, eventually all of us. And so I think it's extremely critical that, the entire ecosystem invests in the time. This is both clinical, non-clinical, and really looks at solving problems and setting ourselves for the next generation.
Okay. Totally agree with you. Thank you for answering that question. How can India become a favored hub for medical education?
So I think, this is a very tricky question, because not all of it can be solved by one stakeholder, so to speak. I think first, the biggest needle mover for this can be the government. Legislation and policies and governance play a big part in access to education, types of education, quality of education, and so on and so forth. And so, for example, I'll give you one case in point. We also heard a lot about people talking about mental health. But are you aware what is the prescribed faculty student ratio for psychiatric training in a PG college? Anybody here has perspective on the number? What I'm trying to say is, for every student who enrolls, that college needs to have how many faculty to do PG education in the mental health space? It's 1:1. So if you have to provide, even if 500 students need to be trained, is it realistic to expect 500 faculty who are postdocs and then involved in teaching? Some of this, is so archaic that, these rules were framed, at the time of independence. In 75 years, nothing has changed. So fundamentally, we have to relook at a lot of this. The other thing is, landscape change, right? A lot of things that we do here somewhere is almost accepted, but I think some of the fundamentals need to be questioned. Today in cities, if you go to a mall, would you visit the mall again if, say, the toilets are not clean, there's fresh air, it smells good? Would you agree to go to a airline or a hotel where the checkout time for you is 6 to 8 hours? Or if you visit any of these places and you have to really hunt for a parking slot, all of these exist today in our healthcare ecosystem, right? You go to a hospital, any good to great hospital, it's tough to find a parking slot. It's tough to find appointment with a doctor. These are very fundamental issues, right? And somewhere these base questions seem to be sort of swept under the carpet, and then people talk about really high-end technical things, which by no means I'm saying is not important. But I think we have to solve for some of these very fundamental issues before we try to boil the ocean and say we will do 20 other things. Another key point is, in the, not just medical education, but in any education landscape, I'm sure a lot of us here have kids, right? Now, if you're in a CBSE, moving to an alternative board like an ICSE, or moving from class anywhere between 0 to grade 9 is accepted, right? All you need is a transfer certificate. But have you ever tried getting your kid into a different school in class 10? And have you understood the challenges you face? And it gets even tougher the moment you want to go into class 12, right? The big reason is, acceptance of certain criteria, etc., just within the school ecosystem. Now, moving on to sort of higher education, we all talk about acceptance of our degrees in international scenarios. But have anybody tried to move from one college to another or one university to another midway through your education? It's next to impossible in India. Because forget international, our universities don't recognize each other and they will not allow transfers. So some of these are very, very simple, fundamental questions that somehow we don't want to ask, we don't want to address. Now, unless these things are addressed and you move to a more evolved system where you first address internal problems, the opportunity to sort of conquer the world and say, I'll be the MVT destination, I'll be the education destination, will really remain a challenge. And at some level, I think, just as has happened in the banking, in the insurance, in the telecom space, I think India as a country needs to open up the education sector in some form, for us to attract the best universities, the best faculty, the best educational system, so that we are able to reap the benefits without having too many barriers. I think a combination of all of these will really help. And so it's a coordinated effort. There's no one magic pill, but I think all of this will collectively lead to a great healthcare future for India.
Thank you for answering that question. My another question is, what are those learning initiatives that you would have done in your company to help people grow in terms of their career path?
I think that's a great question. And, I speak not just on behalf of Aster DM Healthcare, but generally industry at large, on account of, my prior stints in the healthcare space, etc. one of the things is, of course, you need to, if you go to a typical traditional, say an IIM or an ISB, or any, good management or a technology or a healthcare institution, a large part of your learning is done by academicians, right? And if you look at the experience of the academicians and the lens with which they look at all of this, starts off by saying, okay, I am a strategy professor or I'm a finance professor. So at least in our ecosystem, the way we try to do it is first understand, what the real business challenges are and how it's different by geography, by role, by clinical, non-clinical, the legislation. So there are multiple dimensions to all of this. So first we sort of understood all of that. Now, by no means am I dismissing the fact that, the academicians have their own contribution to make. So all of what we try to do in terms of curriculum, etc., while we articulate the business challenges and problems, it needs to be anchored, so to speak, in a sort of academic framework, which is what we are used to, for 20 years of most of our lives, right? Or even beyond. And so we try to marry the both. So what we'd like to call it is for the industry, by the industry. That's our method, if you speak. But we don't stop with that. If you look at the programs that we design, all of them have extensive project work that works, because in your work life, nobody bothers about the marks you scored or any of those typical academic barometers, right? What really matters is outcome. So we try to work through the entire learning journey largely by doing and working by groups, because that's how real life is. It doesn't matter whether you're picking it out of Google or the learning material that we give or a friend's answered you. But what are the outcomes, right? For example, an operations problem can be as simple as saying, how do you solve a parking problem in your hospital, right? Or it can be to say, how do you reduce the work, move more outpatients who come to your hospital to being telehealth patients, right? What are challenges there? How would you do it? How would you reduce discharge time, right? So I'm just giving a couple of examples, more from a management lens, but then you will see a lot of this is at the intersection of, what the clinicians do and the enabling functions do. So these are some things that we integrate in the build design, and we follow it up with integrating with our sort of HR processes. So it's not about saying, okay, you did a program, you came out with a certificate, you have some cases. We try to put the money where the mouth is, so to speak, by saying that some of these projects are evaluated and said, how can I invest so that it can drive either a revenue growth for the hospital, or it can be optimization for the hospital, or how can it benefit the overall ecosystem from a hospital ecosystem perspective. We also look at how this will translate to career growth for the incumbent, right? And so we try to map it to say, how does that map to the talent journey of the incumbent? It doesn't necessarily mean that, it needs a vertical growth. What we encourage is, how can doctors become more administrators of hospitals if they are interested? If somebody is in a biomedical function, how can he move to quality function? Or because we are present in about, 10, 12 countries, how can these incumbent move and operate in other geographies or take a slightly senior role in another geography? How do these work? And so we do a 360-degree approach, and we have a number of programs, that cut across, clinicians, nurses, doctors, consultants, enabling functions, unique programs for each one depending on their role, experience, etc.
Oh, that's great. Thank you for sharing. And I would now like to ask audience if they have any queries, they can please ask. Can you please pass the mic?
Yeah.
Talking about the technology utilization in the healthcare, the future of technology, healthcare technology, I strongly believe lies in digital twins. Creation of digital twin for the patients will throw a lot of integrated data, which will not only help in treating the patient, even virtually, but also helps in generating the pharmaceutical data. What kind of medicines are applicable to that particular patient. Because it's a kind of simulation technique. Simulate the entire process of the particular patient into a digital twin and study that model only. So it's a question of modeling. What we do in engineering, the same thing is parallel is the digital twin technology in healthcare. So what is your view, observation on that? How much have you progressed in that area?
Perhaps what I'm going to reply may be a little controversial. Okay, so some of these ideas appear new. Okay, but since I've been in the education industry, we've seen this for over 2 decades. Okay, the choice has always been there, option is there, availability is there. All you need to do is search, and you will find enough of it. Now there are both free models, there are paid models. Is that going to solve the problem of as you would like to articulate, perhaps, if I'm getting it right, patient awareness? Maybe not. How motivated is a person to solve or interested in knowing this is a very individual decision. He may choose to do it, he may not choose to do it. You may create all of this, but why would someone even bother? What's in it for him, right? Some people like to be more aware, knowledgeable. Some people say it's a problem, it's episodic. 2 weeks I take some pills, some medicine, and I'm done, I have to carry on with my life. So they may not be interested. Now if you want to start a business saying that I'm going to work in the space of patient awareness, I think it's a holy grail. But what will be the economic model? Because you can never mandate it. And do you believe someone will pay money to say, okay, I am taking XYZ drug for diabetes? Is that the right drug? Is it the right dosage? Today there is enough data, that is publicly available for you to at least do a dipstick to say, is it right or wrong? But who's going to understand, how the pancreatic cells are, interacting with these molecules and all? I don't know. I have my own views. It's not a monetizable idea in my perspective, but jury's out there.
For teaching, because
Again,
we are using AI.
optics,
if you are
right?
using AI, you can as well use digital twin also for teaching students and also nurses.
Again, the question is, what is the outcome you are trying to solve?
Outcome is the reduction of the staff. You don't need to have so many staff.
No, I don't think it's a direct correlation. So what are you saying? You're saying here are 100 nurses or aspirational nurses, hypothetically, and you want to train them on, say, diabetic drug prescription, right? Now you may train them. Will the law allow them to do anything? Right? They have to just follow what the doctors prescribe. Now, so in that environment, I understand that, the nurse may be better prepared, may have a better understanding. But today, have you imagined the life of a nurse? Out of 16 hours or 17 hours or 12 hours that she's there, she has to keep standing for 10 hours, right? She's always need to be on the rounds. And she will tell you, the life is very unforgiving. And it's one of the lowest paid jobs in the ecosystem. Do you think she'll be bothered about saying how, pancreas work or anything works beyond a point? She's only bothered about saying, okay, I have to do X prescriptions to Y number of patients. It means I have to do 16 rounds. And my shift is over. I have to go back, cook food for my husband. That's life, right? Now, we all tend to be sort of, look at things from a slightly utopian framework, which is good. It's important for debate, dialogue, discussion. But somewhere you have to stress test it to say, will you do it?
Physical to virtual.
Yeah, so it's good to have, but I don't know.
So virtual can also help, but not so much. Maybe not in healthcare, because I have seen, I've met a lot of people who are into AI tools, and somehow I've realized that for us, when it comes to soft skills, what works best is when you in person go there and you teach those people that this is how you have to behave with the patient. This is how you have to be empathetic. So empathy, compassion, this is not something that we can teach anybody through a virtual class. So that really, that can help, but in a limited frame. Any other questions?
I think we have a couple
We've
of more gentlemen.
Yeah.
Ravi Shankar from Create Labs. I've seen that from your discussion that you're having substantial focus on talent development. My question to you was, given the medical errors and the need to reduce them globally, and similarly in India, is clinical skill training and its simulation going to be one of the focus of your academy?
It is. So clinical training is a big part of what we have embarked on doing. Now, the goal is, we loosely say transforming healthcare learning, right? And the optics and lens for it can be multiple. Now, one is reduction in medical errors. The other is learning new technologies, improving healthcare practice excellence, so to speak, on doctor-patient communication. It has multiple facets. Now, a lot of question is that our ambition may be what we have, and we genuinely, sort of try to contribute to the cause. But tell me, in the academy, number one is that, our audience is not just Aster folks. It's, anybody in the healthcare from anywhere in the world are our students. Now, in that context, how do I measure medical errors for people who come and join? So it's a nice ambition to have, but it's not something that I will be very vocal in communicating unless I have unbiased perspective on what has this transpired to in real life, right? But the hope and vision is to say, how can I influence, such positive behavior and outcomes? I think that's a great question.
Yeah. I have a question here. Previously, there was, in rural areas, there is acute shortage of doctors. Most of the doctors who come out of universities, they prefer only urban areas. So previously, that LMP system, licensed medical practitioners, was there. Hospitals like your Aster and others can take initiative in again bringing that LMPs into existence and providing healthcare facilities to rural areas. What is your take on that?
I think it's a very good question, but it requires a much bigger debate. Let me put some realities that we all need to expect, right? Now, whether we operate as a clinic or a hospital, which is episodic intervention, or the wearables and other things, IoT, which is non-episodic intervention, whether it is in the healthcare space or you're in the business of tobacco or whatever, as long as you have investor interest in mind, your first KPI is, your top line, EBITDA, growth. Now, it's not for lack of initiative or effort that, hospitals have not gone to tier 2, tier 3 towns, right? Like CARE is a great example. They have significant presence in tier 2, tier 3 towns. Similarly, HCG. There are a lot of people who have experimented with that model, so to speak, including Aster. So we have a separate brand in the Middle East called the Access brand, which, as the name suggests, is for blue-collar workforce where access to quality healthcare is challenged. So it's not for lack of initiative, but we are responsible for shareholder value, right? Now you tell me, in a slightly different context. For example, there have been enough hospitals like Vedanta, HCG, etc. We started high-end sort of delivery of healthcare in tier 2 towns. But all their operations struggled for a while before they could even turn the tide. Now, what is the reason for it? Is not that there are not enough healthcare facilities, but as a customer, these people prefer to go to cities and towns because they believe that better healthcare is provided in big hospitals in cities. And so that internal movement of people to get better healthcare exists even if the healthcare operators open facilities in smaller towns. So it's a challenge and works both ways. While it's not for lack of initiative, we have to somewhere balance the revenue, the social ecosystem to say, how do I motivate them and say, no, you stay here, you can get good treatment here. Why don't you trust this doctor? So it's a much larger solution that we need to think through. I don't think there is any prescriptive answer to say if I take LNP, suddenly healthcare in the semi-urban and rural areas will suddenly become different. It may contribute, but I don't know. I don't think I am in a position to give you a complete answer.
All right, so we can see the pop-up here which says time up. But thank you so much thank you so much, Srinivas. Thank you so much, everyone, as being a good audience. And we would now like to close. Thank you.
Thank you, Delhi.
Thank you so much, respected sir, respected ma'am. Loud cheers, please. I think it's been a great, fascinating session. We can have a group photo right now, sir and ma'am. Cheers, ladies and gentlemen. Come on. Now, before I go to the next session, as I said, this is a festival. So can we please cheer a little louder on a countdown of 3, 2, 1? Can we have the loudest hip hip hooray? 3, 2, 1. Come on. Hip hip hooray. Louder, please. Is that the best that you can do over here? Louder, please. Louder, louder. Come on. Okay, come on. I'll take that. We can have a louder one, the next one. The next discussion right now is in focus, telepsychiatry for mental health, bringing services closer for all. Telepsychiatry has been a boon for making healthcare more convenient and accessible. The discussion will be around how it is helping in countering the growing issue of mental health by creating more awareness and initiatives that are being taken up by both private entities as well as government organizations. For this, may I please call upon stage Dr. Anurag Batra, Chairman and Editor-in-Chief, BW Businessworld, and Founder, Exchange for Media. On stage, please. He'll be joined on stage by Anushka Jolie, Co-Founder, Inner Arc BlockTech Private Limited, for this very fascinating discussion. Welcome, sir. Welcome, ma'am. Yes. Louder cheers, please. Kya baat hai? Wonderful. I'm also clapping very hard in front of the mic, so that's also sounding. Of course, sir. The stage is all yours. Thank you.
So, Anushka, I've known about you, and I saw you at the breakfast with your dad, and I didn't recognize you then, but now I know it's you. First of all, Anushka, I'm a loud Punjabi roommate. I don't need a mic there. Is it working now? Perhaps you can use this one. This is also not working. This is. What is the similarity between this mic and Bengali?
Bengali is both allowed.
No, they are not. There's more asking some use therapy, but you can guess where I'm going. Yeah. But it's a little, you're Bengali, will take offense to this book. But we were in school, what is the probability of, I not practice it. I have too many Bengali.
You can write it whenever you want.
Durga Puja, I want to go to their own spot.
Joy Ma Durga.
Get back to mental health, Anushka. So, Anushka, what is your story? How many of you know Anushka's story? How many of you know Anushka's story? One person, you know, of course. So, let her tell her story. She's also, I don't want to give away the winner is about 38 or 30, but she is in the list. And she's the youngest winner in the, and she's less than 70.
I'm 15 years old.
15. You're in the 16th year, right? You're as good as my son. So what is your story? I know your story. Tell the audience, what is your story? What happened that led you to do what you're doing now and the app you created?
So I started when I was 9 years old. After experiencing bullying myself when I was 8, I decided I want to do something about this issue. And I started working on it. I started researching on it. I created a blog website called Anti-Bullying Squad. where I would just write about and talk about bullying. And after that, I did some more groundwork. I went to NGOs and schools. I did sessions. I did awareness programs and campaigns. I created my own online program. And finally, I created an app called Kavach. And that was a bullying reporting mobile app for schools, using which victims and bystanders could report incidents of bullying, and schools could see that and take action. And through my work, I impacted over 2 million adolescents in 20,000 different schools across the globe. Thank you so much.
I hope there was an app like this when I was growing up. But no wonder my children are doing better now. So Anushka Roy is the founder of this anti-bullying app called Kavach. She also raised 50 lakh on the Shark Tank. What did you do with the 50 lakhs?
So I created the first version of my app, and I've also used it to create the second version of my app and the third version. So now I've expanded from just bullying to mental health as a whole, because I've started to see
more content in the app.
right on any aspect of an adolescent's life, or any parent, so they can see content on how to take care of their mental health, their physical health, what to do about it, and all of that. And I'm also working on the first mental health metaverse in the whole world as well.
All the way when you started it started as a hobby, right? Did you perceive it as an entrepreneurial venture that it will become a venture for you?
I always perceived it as an entrepreneurial venture. So when I was 9, my mom and dad and we used to love watching Shark Tank. We were huge Shark Tank fans. And so I used to watch that series, and both of them are also entrepreneurs. So we used to grow up having these entrepreneurial discussions on the dinner table. It was always like that for me. So, I always thought of it that I'm going to be a huge entrepreneur, a huge businesswoman. And when I started this also, that was my vision with it. I didn't know how I'm going to go from an anti-bullying blog to an entrepreneurial venture, but I knew I was going to get there somehow.
And what has been your parents' role in supporting you with this initiative? How much is their involvement in what you do? How do you seek guidance from them?
So my parents have been involved since day one. And I think, I couldn't have done it without them, because apart from their guidance, they've also been huge pillars of support for me. Because when you're that young, you have a vision in place, you have so much ambition, you don't really have the knowledge or, the path. And they have kind of helped me create that path for myself, which is something that I've seen even parents around me are unable to find the importance of empowering their children. A lot of parents think that, if my child, for example, is facing a problem, getting bullied, or anything, they have to step in and solve the problem themselves. But what my parents did differently is that they empowered me to go fight the problem myself. And I think that's why, after that empowerment has taken me places where I have, grown myself, and I've had that power or that intelligence to keep on moving forward.
Tell us, because of your app, your data, your insight, give us some insights into the issues that teenagers face. What are the mental health issues? Give us some data points. Give us some insights that you gain along your journey of building this app and building a community of teenagers who need counseling support.
So, to start off, when you all were growing up, or when, for example, my parents were growing up, life was, I think, simpler back then. It was very simple. They used to go to school and they would come back, they would eat dinner with their family, watch TV, and go to sleep. It was pretty simple, and they would play with their friends. And a lot of these problems, like, for example, bullying or having a fight with a friend, it wasn't really highlighted or spotlighted as such. But now we see, because of technology, we see because the world is becoming more complex. That is also having impacts on these adolescents and the way they perceive it. And so I can see, people are becoming less sensitive. People are becoming, because there's a screen dividing people. So lack of empathy, definitely huge issue. I mean, kids are less empathetic. They don't care what the other person thinks, and while that can be good in a lot of ways, it can have drastic impacts on the kind of social connections they would be able to form with other people. And also, apart from that, technology, gaming, and all of these social media, and all of these, aspects that have really impacted the way they kind of perceive others. This, fast-paced world. And that's where a lot of these mental health issues, these confusions, due to this overload of information, that's where a lot of these issues come in.
Ms. Jolly, I met a lady called Perry Aftab in BW Businessworld 10 odd years back. She's the number one expert on cyberbullying. In fact, she runs a worldwide program. I think you should collaborate with her. Also, cyberbullying then takes a segue into cybercrime, which has multiple dimensions. Now, tell me, how have you used, what has been the impact of your app? We know what your app does. Give us some stories that illustrate the meaningfulness and the impact of the app. It felt worthwhile that you created what you created, and it's, give us some stories.
So I receive a lot of emails almost every day. I receive DMs on Instagram where people have kind of thanked me for doing the work that I'm doing. There was this one email I got after I launched my program for schools on mental health and violence issues in schools. What can they do about it? And there was this one girl who I still remember the subject.